So in the last kind of 10, 15 years, we've learned a fair bit about impact through rigorous studies of innovations that were about to be scaled or that kind of left kind of the pilot stage. A very good example, and possibly the best known example, is in the nutrition impact area, where on the biofortified food, there has been a series of studies showing very clearly kind of health benefits of the biofortified innovations in real-world conditions with farmers or other end users. Those were done as part of the research program and moved gradually from efficacy to effectiveness studies to looking at adoption at scale and any ultimately impact at scale. There were collaborations between biophysical and social scientists as well as outside experts. But that's only one area where there is a body of evidence. There is other similar studies, kind of what SPIA calls learning studies, early impact assessments of innovations when they were about to, when they had a stage where they can be scaled. That's true for climate resilience innovations. That's true for kind of certain management practices, but also innovations, for instance, in the diffusion mechanisms themselves. The question is, what is the value of this type of impact evidence for the stage-gated process, or what could be the value of this evidence in the stage-gated process that is being considered? This can not only help to show whether an innovation has promise to scale, but in fact can help to increase the potential to scale. And indeed, this is true for the CGIAR. It's actually true more broadly for innovation thinking. And a recent paper by Michael Krimmer, who is one of the 2019 Nobel Prizes, Nobel laureates in economics, but who is also the scientific director of the development innovation venture of USAID. So he shows in a paper that in DIV, the innovations where researchers were involved in the early impact assessments have a higher probability of scaling. And that is, so he shows that empirically, but if you think about why that may be the case, it's because those outside researchers not only bring rigorous methods, but also bring an outside perspective and of course bring independence and a different way of thinking of the innovations and those than the researchers that were generated. The point of these type of impact studies is to focus on constraints in the real world, and that complements the research that went before it, and to focus not just on these constraints, but on how to lift those constraints, starting from the insights of the theory of change, and indeed using the evidence to improve the theory of change. So think, for instance, on innovations in environmental health, or think of innovations on pest resilience or disease resilience in the livestock sector. Or indeed, we can think of something we all think a lot about, social distancing, where the evidence coming from the science, the advice coming from the science is very clear. But we also see that when we try to implement this in the real world and in different types of contexts, we face different constraints, and we face different behavioral reactions, indeed very different across the world, which makes sense given the differences in context. But it also means that it's hard to predict. And so ideally, when we're in a situation where we can test before we implement things at scale, that may help to refine how to do this. Ultimately, when you think of the CGIAR, as indeed is the case in this recent crisis, we're talking about interactions between biological processes on the one hand and human behavior on the other hand, once we scale these innovations. And we know there's a lot of uncertainty involved, also coming from the natural environment, and a lot of complexity. And so we should expect that there's a number of things that we don't necessarily can anticipate, but we can test and improve along the way. So this is what those type of studies try to do and what they can contribute. They can also try to help understand which characteristics of the innovations can help prevent scale or can help prevent reaching certain populations. And of course, that's key for the impact areas of gender, of social inclusion. Kind of what is it that makes certain innovations more accessible or more of interest to certain target population. The key message I want to convey is that for that to be useful, it can't be an afterthought, or it can be something that is based on a quick assessment at the end of a program cycle, nor should it be something that is based on a very large set of indicators with a lot of investment there. Rather, you want kind of the impact studies to be part of the research itself, rigorously designed like the rest of the research and like the rest of the research with the right time horizons, so that the result of it can be feedback into decision making independently of what the result is in a certain way. And those can be decisions about whether to scale, but also how to scale, what complementary policies to put in place, or how to adapt the innovations itself. Think, for instance, of climate smart practices. We know those can be complex. We know that there can be challenges with NRM farm level innovations to be adopted at scale. But we also understand when we think of the real world constraints and the behavioral adjustments, why that may be the case. You know, it takes time for farmers to learn about those innovations. They may need a little bit of temporary additional incentives to do so. And once we kind of test potential mechanisms to address those constraints, we can then think about kind of effective dissemination strategies to scale. So that requires collaborations between CG scientists, impact assessment specialists, but also kind of a larger set of national and international partners. And then by making the impact assessment work part of the research, it becomes de facto kind of part of a results-based management framework.